Okay, so today we're jumping into a story about a huge medical success, a real triumph that, believe it or not, has created a brand new and pretty urgent challenge.
And it all starts with this one powerful number, 2.5 million. That's how many people in the US are living with a heart condition they were born with. It's called congenital heart disease, or CHD. And for a long, long time, this has been an incredible story of survival, a true win for modern medicine. More and more kids born with these heart defects are now living full lives well into adulthood. But that very success brings up a really important question. What happens next? As this group of survivors gets older, they face a whole new set of hurdles. And one of them, in particular, has become a major, life-threatening problem. And that's exactly why researchers at the Mayo Clinic started digging. They saw this growing issue and realized they absolutely had to find some answers for this unique and expanding community. So, what's the big problem? It all comes down to heart failure. For adults with CHD, it's not just a risk, it is the single leading cause of death. And that's what the study zoomed in on. Dr. Luke Burchell, who was a lead author on the study, really hit the nail on the head. The huge challenge for doctors was figuring out which patients were at the highest risk. They knew heart failure was a threat, but they needed a better way to see who was most vulnerable. Because, the usual heart failure programs just weren't built for this younger population. So the team dug into a decade's worth of data. And what they uncovered was, frankly, alarming. It painted a really stark picture of a crisis that's growing fast. Just look at this chart. The increase is staggering. From 2010 to 2020, hospital stays for heart failure in these patients more than doubled. It went from just over 6% all the way up to 14%. That's not a small jump, that's a surge. And after one of those hospital stays, well, this next number is pretty sobering, 86%. So what does that mean? It means an 86% higher risk of dying in the years after being hospitalized for heart failure. It just goes to show that making it out of the hospital is far from the end of the story. That time right after discharge is incredibly critical. But it's not just about mortality risk. There's another really important number here, 40%. And as Dr. Burchell points out, it's not just about survival. 40% of these patients end up having a major complication after they leave the hospital. We're talking about things like another round of heart failure, a stroke, or atrial fibrillation. The big takeaway here is that a hospital stay for heart failure kicks off this period of extreme vulnerability. Okay, so the data clearly laid out the danger. But, and this is the best part, the study didn't just stop there. It also uncovered a clear, simple solution, a real lifeline in those crucial weeks after a hospital stay. It all boils down to what happens in a very specific window of time. So a patient gets hospitalized with heart failure, then they get discharged. Those next 30 days, that's the critical window. And a decision made right then can change absolutely everything. And this slide just lays it out perfectly. On one side, you have patients who didn't get specialized care right away. They faced that same high risk we've been talking about. But look at the other side. For patients who saw a cardiologist within just 30 days of leaving the hospital, the difference was night and day. A significantly lower risk of death, both at 90 days and a full year later. This discovery really flips the whole script on how to care for these patients. It's all about getting proactive, about shifting from just managing a crisis to actually building a more hopeful, stable future. This quote from Dr. Burchell really captures that new philosophy. The goal isn't just to avoid heart failure, it's to actively improve heart function, to help patients feel better and live longer. It's a small change in words, but it's a huge shift in strategy, from playing defense to playing offense. And the amazing thing is, we have incredible tools to do this right now. There are new medications out there designed to boost heart function. We even have these advanced procedures, like replacing heart valves without even having to do open chest surgery. The technology is here. So if you take one thing away from this whole explainer, let it be this. For an adult with congenital heart disease, getting to a specialist within 30 days of a heart failure event, it isn't just a good idea. The data shows it is, without a doubt, life-saving. And that kind of leaves us with a final thought. For this community of survivors, this product of decades of medical success, maybe the key to a longer, healthier life isn't some new miracle drug or surgery. Maybe it's something much simpler, just getting the right care at exactly the right time.